Hey everybody, my name is Kyle Heise. I'm a student physical therapist at the University of Findlay. I'm coming back today with the presentation for you guys, a follow-up from that needs assessment I had you do. So I collected kind of the data that you guys provided with me with the feedback and put together this presentation for you guys. So the title of it is Fall Prevention for the Elderly and Caregiver Safety Training. So, the objectives for today. So, sorry how I'm doing this. I'm going to be behind the computer because I got to record this. I provided each of you handouts, a copy of the slides, the home exercise program, and the assessment that I'll go through for a little bit for caregiver burden. But for today, so I'm going to briefly go over some of the statistics for falls in the elderly population, caregiver burden, and the awareness that it comes for self with that. The different stuff to look at for fall prevention, a home safety checklist to limit the likelihood of a fall in the house, then caregiver back safety, lifting techniques, and then the big one that you guys wanted to know about is core and back exercises to decrease back pain and improve the longevity of you being a caregiver. So, statistics. So, falls are a serious issue for the elderly. It is the leading cause of injury-related deaths. It is the number one cause of hip fractures. It decreases mobility after the fall, and it's a very large loss of independence. So in 2014, about 25% of older adults, this is 65 years and older, have reported a fall. So that comes down to every second of every day, somebody has a fall, and then of these people who fall, every 20 minutes, there is a death that is directly related from the fall itself. So as you see, it's a serious thing, and it is it's the leading cause of emergency room visits, and it is a $30 billion medical cost that has been reported in 2014. All right, but thankfully falls are pretty easy to prevent with simple screening and keeping active and medication reviews. So yearly screens are important with the physician. They'll talk about medical and physical status with you. If the physician kind of finds something or seems that there might be an issue coming up, they will most likely refer them to physical therapy to address and figure out the issues to relate to that. And then that comes into keeping the patient active. So as we all know, the patient that we're talking about is not very active, likes to be sedentary. So it's important to keep the patients moving. Try to have them do as much for them as they can, much for themselves as they can. Simple exercises, arm exercises, leg exercises. If we can do like a walking program, ideally you could do like a community exercise program, but I know the patient we're referring to is never going to do that. So any other ways we can keep them active is super important. And then medication review with the physician is a good idea. So there's a lot of different medications that can kind of increase fall risk from like blood pressure issues, which I know this patient has. And then some of the other fall related things is like from decreased sensation and the edema that the patient has, which medications can help reduce that so they can actually feel their feet and move around better. So it's something to keep in mind when you see them for the yearly checkup. All right, so caregiver burden. So in 2017, about 24% of adults in Michigan have reported being a caregiver or providing assistance for an older adult, usually a parent or grandparent. And 15% of these adults have reported having insufficient sleep, mental distress, and feeling unhealthy because of this being a caregiver, unplanned being a caregiver. So, and unfortunately, nowadays with the cost of medical everything, family members and friends and relatives usually end up having to become caregivers, and with no formal training. And this is very stressful. It's not prepared for, and is often happens at an inconvenient time. So, but in my experience, just some basic, simple training, and then kind of walking through some of the basic tactics decreases stress for these people. So like some of the lifting stuff and exercises that I will talk about later, and then the home safety checklist, kind of decreases stress because you know how to handle situations when they arise. And then being a caregiver is often isolating and you feel lonely and trapped. So feel free to, like, don't be scared to reach out to other people and ask for help, or even seek out like hiring and help if we need to. And taking care of yourself is very important, which leads me to the next thing, the Zaret Burden Interview. I found this assessment online. It's a 22-question questionnaire that keeps track of your own self feelings about being a caregiver. So, like, how do you feel? Like, question 1, do you feel that the relative asks for more help than he or she needs? So for the person that we're talking about, I would probably give that a 3. He can do a lot, but likes to have people wait on him. So that's an issue that we can have a conversation with him about, and what it's causing to our own mental stress. So I have a copy of this in the handout. I think it's a good thing to kind of run through maybe every 6 months, just to kind of keep tabs on yourself. If you do feel like stressed and heavy burdened by this, that you can reach out to for like mental health or community organizations to talk about it, or even have other people hired in to take the burden off of you as a caregiver. All right, fall prevention. This is the big thing that you guys wanted to know, because the patient that we're talking about has had a few falls recently. Thankfully, there's been no injuries from it, but it happens quite a bit. And the patient is like, oh, it's not my fault, no big deal. So let's quickly run through this. So age is a factor. As people age, 65 years and up, as they increase in age, the likelihood of falls increases because of that, due to age-related changes. Gender, statistically speaking, I found that females have a higher risk of falling, and those falls usually relate in bigger issues, because like osteopenia, low bone density, they have fractures, hip-related fractures, stuff like that. Leg strength is important, so the lower extremities, keep them up, keep them moving. And in this category, I often put the like foot and ankle sensations. So I know this person gets edema from time to time in their feet, and is unaware of where their feet are going and if they're stepping on stuff weird. So this is a part of that yearly review, medication review, that's important to keep tabs on this. Balance disorders. Thankfully, the patient we're referring to doesn't really have any of these, like Parkinson's, dementia, stroke, or diabetes. They just have edema from cardiovascular issues. Visual impairments. This is important for the patient we're talking to, because he does have bifocals, so the difference in looking in the lenses can make a difference with falling. The lighting in the hallways is very important, especially at night when they go up. He gets up to pee frequently, so having easy access to turn on and off the lights is very important to prevent falls at night. Cognition impairments. This patient also is starting to get some of these. You can tell the short-term memory is starting to fade, just decreased safety awareness, but has not been diagnosed with anything yet. But that's something that the yearly screenings would likely detect. Postural hypotension. So this is blood pressure changes, blood pressure drops with position changes. So when he gets out of bed, he often feels dizzy, and then sometimes when he stands up from a sitting position, he often feels dizzy. So this is due to the body not being able to compensate for the changing in position, and then he can pass out. So I know this has happened once in the past, so encouraging the patient to take their time once they're up and moving is very important. And then the medications kind of related to the same thing. So with the physician, it's important to keep track of like the blood pressure medications, like muscle relaxants, pain medications with opioids, antihistamines, and antidepressants, because any of those can increase fall risk and sometimes make you altered or cause like impairments in sensation. And then environmental factors we'll go over in a minute, but like I said, lighting, and I'll go over the home checklist in the next slide. So the home safety checklist. So I have a big handout which I got from the CDC. I have for you guys and we can run through after this if you want to, of stuff to look at in each room of the house to help decrease the chance of falls. So, like, let's go for the first one. So, like, can you walk freely through the house? So, the majority of the rooms in this house are yes, but the bedroom is one that we should be looking at for falls. Thankfully, he hasn't fallen in there yet, but it can be an issue. The one that I see all over the house are the throw rugs. Throw rugs are a huge fall risk for the elderly, especially when they use a walker, which he does. And I know from the past he has tripped over the throw rugs. So we just have to convince him and let us get rid of most of the throw rugs. So, but all these are important to go over. I know we got the 2 handrails. The rooms are well lighted, but the patient just has to remember to turn it on. All right. So on to for caregiver stuff. So back safety. So I like the graphic on the side that I put here. So even though we're caregivers, it still relates to like a workplace environment. So back pain is the second most common reason for doctor's visits, and 25% of all missed days of work are due to back injuries. So that's important for us since we help this patient move from time to time. If we're doing it improperly, we can injure ourselves, and it's not good for him either. So proper body mechanics, which is kind of no bending, lifting, twisting, lift with your legs, don't overstrain, get the patient close to you prior to lifting, are all very important things prior to helping do a transfer. All right, and then the body mechanics while you're lifting and doing the transfer is super important. I know there's one of you guys who has frequent back issues, and it's because you're doing improper stuff with this. So I know when I see you lift in the past, you've had some twisting motions because you didn't prepare for the transfer in time, and you were lifting with your back instead of your legs. So maintain your natural arch in your back and tighten the core, which I'll go over with the home exercise program. Lift with your legs, not with your back. And prior to doing the transfer and helping the patient, you need to get your feet in a good, steady position to help get the patient from A to B. All right, lifting techniques. So thankfully, we all don't have to do this a lot for this person we're talking about, but encourage him to help as much as he can. I know you guys have a gait belt, transfer belt. It's important to have that on to help kind of move his body, keep him under control. If he ends up losing balance, it's easy to correct it to prevent a fall that way too. Make sure the patient has proper footwear on. I know sometimes he doesn't like to wear those. As I said, get him close to you and use proper lifting techniques prior to standing him up and getting him over to the chair. All right, so the caregiver stuff, the exercises. This is what you guys wanted to know. So what is the core? The core are all the muscles that help maintain your spine in a proper alignment while doing like dynamic movements, such as lifting a patient or any other activities that you can do with them. So there's the muscles that run along the spine, the multifidus muscle, the spinal erector muscles, and then the abdominal muscles, more specifically the transverse abdominis. These are all very important muscles for keeping the core steady. But then the diaphragm and the pelvic floor are also very important to maintain that core while you're doing lifting techniques. All right, so what are the other core muscles that we need to focus on? So a lot of people think it's like always just the back or always just the stomach. A lot of it it's like activating both at the same time. It's more stability exercises rather than like crunches or dynamic movements. So And then your butt muscles, your glute max, your hip muscles to keep you steady. Those are also very important to keep strong because that's where your power comes from when you're doing the transfers and you have to lift the patient. All right. So I have this home exercise program. I gave you guys all copies of it. So I know you guys are worried about like when you have back pain, what to do. So and what to do to prevent back pain. So on the first page, I put all of like your strengthening exercises to keep you strong when you're not having back pain to limit the recurrence of back pain in the future. So the bulk of this all relates around the abdominal bracing, which is the transverse abdominis activation. And we can go over some of this afterwards if you want to. And then page 2 of it is like the stretching and flexibility exercises, which like when you're having back pain, I think these are going to be the more important ones to limit the severity of back pain and keep the body flexible, so you don't kind of like lock up, which I know one of you does. You get tight back muscles and they spasm. So these are important ones to maintain your mobility. And like I said, we can go over these after these. We can go over all these afterwards after we're done with the presentation. All right, so here are the references that I have for this. And then if you have any further questions, please reach out to me. You all know me. You can call me or you can email me at the email address provided below. Thank you guys for bearing with me for a little bit. I'll talk to you soon.